Good morning, Dr. Seneviratne. Great to have you on our program, The Business Detective. To begin, can you begin by discussing the importance of early detection of cancer?
Yes, it's a pleasure to be here, Dinesh. Um, so I've been in this field of cancer now for 25 years and seen a lot of great strides being made in the treatment of cancer. Um, we're beginning to understand the biology of cancer, how cancer cells are being, how they thrive in our body, how they escape immune surveillance, and so on. So we're just beginning to understand all these mechanisms and are coming up with great treatment strategies. Having said that, cancer is always trying to outsmart us. And so when we find a pathway that we can block, maybe the cancer is 10 steps ahead of that and trying to find an alternate route. So I think this is one place where I truly believe prevention is better than cure. Um, so in that sense, there are certain cancers that we can exploit their natural biology, their natural history, because these cancers do have a latent or an indolent phase before they become bad actors. Um, a good example is colon cancer, for example. Um, there's about a 5 year latency or a period where a polyp is just starting to be, grow in your colon. And if you leave these polyps alone, maybe 5 years, 3 years, 4 years, whatever, they will turn into cancerous lesions. So during this time where the polyps are there, you don't have any symptoms, you don't have any signs, you're going about your own, doing your own thing, normal life. But that is where you can actually make a difference if you catch them at that stage. So how do you do that? There are tools that we can utilize to catch them, and those are like fecal occult blood testing, sometimes colonoscopies. They are the gold standard right now. People say to start doing colonoscopies at the age of 45. By doing that, you will catch them at a pre-malignant or a polyp stage where you can get rid of them. And, as we call it, you can nip it in the bud without waiting for it to uh, get into something more serious. Another cancer that we can exploit the natural history is breast cancer, where a woman may not feel anything, no palpable lump in the breast, no nipple discharges or anything like that, but there is a cancer brewing in their breasts, and sometimes it can be just dots of calcium that are present. And how do you detect them? By doing your mammography. You do your mammograms, and then you detect these little calcium deposits, and then you go and biopsy. There is a cancer brewing, and if you catch it at that stage, very high, almost 100% chances of cure. So I would certainly advise, when possible, when available, make use of these early detection screening tools, and you will be much better off than dealing with a cancer treatment later on.
Okay. So, doctor, how does a healthy lifestyle as well as good food help to prevent cancer?
So I think there are certain things, environmental factors, that definitely impact causes of cancer. One is obviously smoking has been, linked with many different cancers, not just lung cancer, but throat cancer, bladder cancer, pancreatic cancer. At least 6 different types of cancers have been linked to smoking. And so that's something that we should definitely discourage people from doing, is smoking. And that same thing goes with vaping and other methods of inhaling these fumes, because vaping has become a big thing now in the Western world, but they are equally dangerous. The other thing is, of course, certain carcinogens, as we call them, is in food that we consume. A lot of these processed foods that have a lot of these, sweeteners, artificial stuff. I think we should refrain from consuming. A healthy lifestyle with diet and exercise has been linked to um, less incidence of certain cancers. Colon cancer, again, has been linked with obesity, consuming a high fat diet, and also a diet rich in red meats. Because what happens with high fat and red meat diet is that um, the uh, the stool material, the fecal material, sits in the colon for a longer period of time. There's a longer transit time, and there can be certain carcinogens then being produced that goes into contact with the surface of the colonic mucosa, as we call it, causes changes. So diet has been linked with certain cancers. Obesity, when you have excess fat in your body, that produces more estrogen in women. It has been linked with breast cancer, obesity, and excess body fat because they have high estrogen levels, and that can cause certain cancers. There are a lot of other theories. I mean, infections can be also linked with cancer. We know that certain viruses like HPV can cause cervical cancer. So now there are vaccines for HPV for young women who are sexually active. There is a bacteria called H. pylori, which is consumed in food sometimes, which comes with gastritis. That can be also eradicated if caught early. So these are some of the leads I can give you.
Okay, doctor, how do you compare Sri Lanka current state of medical care, especially for cancer, with some of the developed countries?
So I think our doctors are very, very good. They're well trained. They go abroad and get all these state of the art training. However, I think our infrastructure is lagging quite a bit when it comes to cancer. Some of the basic drugs are not available, and so without those, you cannot fight cancer. Um, in terms of cutting edge treatments, I think one of the main things I would suggest that if Sri Lanka can get is our clinical trials, where you bring the greatest and the latest and the next best thing made available to our patients. Um, what I call tomorrow's treatments made available today. Um, Most of the time, these clinical trials are sponsored by the pharma companies and some other agencies. So it's provided for free for our patients. So it's a win-win-win. The patients get to make use of these cutting-edge therapies. Otherwise, they would never be able to access. Sri Lanka gets some recognition in terms of having these types of cutting-edge therapies, and of course, the cost is not a burden for the payers or the patients. So these are some of the things I believe are important for our patients, our cancer care, if we are to compete with the rest of the world.
How do you compare the regional countries like India, Nepal, Singapore when it comes to cancer treatment?
I don't know enough about Nepal, but India and Singapore are very well advanced in their cancer treatments. Um, they have a lot of the state-of-the-art equipment and techniques. Bone marrow transplants, one of the prime examples I can tell you. Sri Lanka is still trying to get a program going for transplant, what we call stem cell transplants. But India and Singapore are way ahead of us, I think, in those techniques. It can be done in Sri Lanka for sure because we have the expertise, we have all the resources. So if we can get the infrastructure in place, I think.
Doctor, another big challenge Sri Lanka faces is the brain drain. We have lost a lot of doctors in the last 2 years. What are some of the options we have to retain some of these doctors as well as get some of the doctors back into the country?
I think the most important thing is the economic and the political stability of the country. I believe that there is a lot of brain drain right now because of that uncertainty. if we can stabilize the infrastructure and the economic conditions of this country, and bring good expertise from abroad. I believe that, again, I'm not in a position to comment on the current situation, but I think the brain drain is mainly because of the uncertainty, is my feeling. But I believe if we give them enough opportunity to establish. So, for example, I'll give you a good example. I was at the Maharagama Cancer Hospital, and there's this young physician who has just come after being trained abroad to start a pediatric allogeneic bone marrow transplant program. So that is one of the life-saving measures when children have acute leukemias, is to do what is called an allogeneic stem cell transplant. Now, she's trained in that, very, very committed to starting this program, but has a lot of logistical barriers. There is some infusion of uh, finances that has to go into to creating a transplant unit. If they can't do it, and if they can't live up to the potential that they are capable of, then they're going to leave and seek other. So we have to encourage these young physicians to bring these cutting edge therapies, give them enough resources, and encourage them. I think then physicians will stay in this country. Not just physicians, all the brain of running a country.
What about some of the emerging technologies that are available for cancer treatment?
So that's a great question. I can go on forever on that. But one of the things we have understood is that what is causing these cancers to survive in the body, because all of us have certain cells that have the potential to turn into cancer, but it's our immune system, our immune surveillance, that always constantly looks at these cells. There are checkpoints in our body that looks at these cells and say, oh, these are bad cells, so let's get rid of them. Somehow some of these cancer cells escape our immune checkpoints and immune surveillance. And understanding that mechanism has been a big advance in the way we treat cancer. Now we can make use of our own immune system to kind of retrain these immune cells to recognize these bad cancer cells, and the immune system then can mount an attack towards getting rid of the cancer. So we're going away from things like chemotherapy. Chemotherapy is more like I call it a shotgun approach. It kills anything and everything that comes in its way. Now we have more immune attacks or immune treatments. We do have certain targeted treatments that goes, I call it like a drone attack, goes looking for the cancer cells, the enemy, binds to the enemy, and drops the chemotherapy right onto the cancer cells. So there's a lot of more precise techniques in terms of treating these cancers with more efficacy and less side effects.
Okay, doctor. Can you also provide an overview of the current state of cancer research in the US?
Again, I think the main focus is on trying to find out what causes these cancers. Number one is what is the trigger that causes a cancer cell to go haywire. All cells in our body are tightly regulated by a so-called as central command that says multiply when it's needed and then stop multiplying when it's not needed anymore. But certain cells don't listen to that command, and they just keep growing and growing and growing. And this is most of the time it's due to a genetic error. So they're looking at these genetic errors. For example, a good example is something called CML, chronic myelogenous leukemia. When you get this disease, in the past, it was a fatal disease, or the only treatment was a transplant, an allogeneic transplant. Then they found out what actually switches on this, the gene mechanism that switches on these cells to keep growing uncontrollably. Then they came up with a pill that actually goes and switches that off, that signal off. So a necessarily fatal disease has now become manageable with just pill. So these are the types of lung cancer. There are certain types of lung cancers that are driven by what are called a driver mutation. So you go into the root cause as to why these cancers happen in the first place, what triggers them, and then they've come up with a treatment that goes and and addresses that root cause. That's very powerful. The other one, other main focus of research is on actually altering the genes, gene therapies, even for non-cancerous conditions such as thalassemias, which is very, very common in this part of the world, or sickle cell that's common in the US. You go and you alter the genes by a method like CRISPR, and then you do gene therapy. So trying to get to the root of the cause and trying to alter it at that level is where the next wave of treatments are. But as I said, immune treatments, how to you know get the immune system to its fullest potential to try and once you train the immune system to recognize that this is a bad cell, they go into a memory cell, so that even in the future, if this cancer were to ever raise its head, our immune cells have that memory bank that says, oh, this guy is trying to raise its head up again, and immediately mounts an attack. So powerful that you can keep these cancer cells suppressed so long that you can cure them. So those are the two, I would say, are the main areas of research.
Will stem cell treatment also become a huge opportunity to deal with cancer?
Yes, I mean, stem cell transplants are already there in a lot of the hematologic malignancies. But now what's becoming more vogue is what we call CAR T cells, or engineered T cells, your immune cells. So it's not just the stem cells. These are your immune cells. You take them out, you engineer them in a way that they then reinfuse them and then mount an attack on the cancers. Yes. Stem cells are mostly for like leukemias and lymphomas.
Doctor, my final question to you is, since you have been working in the US for a long time, how do we upgrade the quality of medical care in our country overall?
I think it has to start with some of the basics here, where I believe that we are in a culture where we want to go the doctor for every little thing. If you have a headache, they feel like you have to go to a neurologist or a neurosurgeon. If you have a little, diarrhea, you go to or a stomach ache, you go to a GI specialist. I think we should try and improve our primary care base and give good primary care physicians a good base for them to take care of patients. Prevention is very important. But when it comes to the specialists, I think they should be only, I believe that these specialists are inundated with work. So they don't spend enough time with the patients or give enough attention to detail. It's not a criticism, but that's how the system has worked. And if you can just keep the specialists at their niche and have a lot of primary care base, take care of the general day-to-day conditions, that would be great. Keeping electronic medical records, I think, is also very important. So when the patients come back for follow-up, you have a record of what's going on. And then, using a lot of the technology wisely, not abundantly, is also important, I believe, in terms of getting the resources optimized.
Quality of drugs?
Well, that's very important. I mean, if you don't have good quality drugs, there's nothing, the whole game. That's, I think, a given that there should be a certain quality of these drugs that are administered, because otherwise there's no point in even treating a patient if you don't have effective drugs. So that's, in my mind, that's a given, but that's very important.
Should we encourage global companies then to come and set up pharmaceutical manufacturing in the country by incentivizing them?
100%. I think we should definitely encourage, because this is a huge globalization in this whole industry. You can't be in a bubble. You have to be with the rest of the world. And there are other countries in other parts of the world who are really embracing these. That's why I said clinical trials, bringing them here, getting them uh, to invest in this country. I think that would be a huge uplift for everybody, for the country, the patients, and for the whole health system.
Thank you, doctor. It was great talking to you.
Thank you, Dinesh. Lovely to be here.